So in this segment, we're going to be talking about no pay rise for NHS workers in Sunak's budget, a report says. So Dishi Rishi not dishing out payments to NHS, workers who have put it all on the line for the country, and them along with obviously key workers have really bailed out this country, and they're not getting the respect that they deserve, quite frankly, and it's just embarrassing but not surprising from this government. And I've just covered a segment from the Labour Party with Annalise Dodds, where she talks about being against higher tax increases on corporations and stuff, when you could use some of that money. I know it's not going to cover a lot of this, but you could at least put some of this money towards the NHS. I don't understand the Labour Party, but it's not important. Sorry, it's just in the back of my mind because I've just done that video. So the Chancellor is set to skip over any announcement on pay rises for NHS staff in his budget next week. It's been reported, citing senior sources from the Treasury. Our newspaper reports that Dishi Rishi will not make that's his official name. I don't care what anyone says. Will not make any decisions on salaries for healthcare workers, as he is awaiting the NHS pay review body's report in May. So he's kicking this in the long grass, basically, because we know the Conservative Party love ignoring reports and stuff like that. So unions representing NHS staff, including nurses, junior doctors, paramedics, cleaners, and porters, say this means it could take months to make any decisions on pay rises for workers. Sarah Gordon, head of health at Unison, said the government has had ample opportunity to decide on early and significant pay rises for burnt out staff who've been working flat out during the coronavirus crisis. And I would add understaffed, underpaid, undervalued, right? All of that. And they've put their absolute lives on the line here in order to keep this country going, and they're not getting the help that they deserve. I've got a video coming out about the NHS and about single payer systems as well. The pros and cons of it. Subscribe for that, because this is definitely one of the cons of it, having the government in control over the NHS finance. So she said money must be found to deliver it in the budget on Wednesday. This can't be allowed to drag on endlessly into the summer. The public expect NHS workers to be recognised and rewarded without delay for the risks they face keeping the country safe. I mean, we clap for them. The government are going to say, is that not enough? Clapping for the NHS. She added that without a pay rise, there would be an exodus of employees from an already understaffed healthcare system. And to be fair, I wouldn't blame them if they left. I honestly wouldn't. Unison has been campaigning for a £2,000 pay rise for the NHS staff to ensure all are recognised equally. I think that's a good move. I think for certain employees like nurses and things like that, paramedics, I would go higher. But, under this government, you'd be lucky to get, anything, to be honest. Labour MPs were quick to criticise the news, describing it as a kick in the teeth. Angela Rayner accuses Boris Johnson and Sunak of clapping for carers last year as a photo opportunity. 100% correct from her. She said a pay rise is the least our NHS and social care and key workers hero deserves after all they've done for us. Not to mention that they're going to have to start paying for parking again, and the fact that a lot of these healthcare workers have ended up with things like PTSD from all the death surrounding them because of COVID. But that's neither here nor there, because the government aren't going to fund the NHS properly, and they're definitely not going to fund mental health properly. So who knows? She tweeted, a pay rise is the very least they deserve. NHS, social care and key worker heroes deserve after all they have done for us. Boris Johnson and Dishi Rishi fell over themselves to clap for our carers for a photo opportunity and to sell them out and kick them in the teeth. I think for key workers separate from the NHS, sort of like retail workers, warehouse workers and all that, I think they should get some sort of one-off payment because they've kept this country going. Honestly, they should get some sort of reward out of this, because if it wasn't for them, the country would be screwed. And a lot of them put their lives on the line. Frontline staff workers who, customer-facing roles and all this stuff, interacting with loads of people. They should get some sort of, payment boost out of this or something, because they put it on the line for this country, and this country will not reward them. Just like it doesn't reward, veterans, etc., people who actually have put their lives on the line in different ways. So it's just embarrassing, to be honest. Jonathan Ashworth, Shadow Health Secretary, commented, our NHS staff deserve a fair pay rise. If Dishi Rishi next week refuses, it will be a kick in the teeth. The government announced in July last year that almost 900,000 public sector workers, including some doctors, teachers, and police officers, would receive an above inflation pay rise of up to 3.1% in a 3-year deal. However, nurses were not included in the announcement due to a separate 3-year deal negotiated in 2018. The deal also did not apply to junior doctors after they agreed to a 4-year pay deal in 2019. But I bet you if they offered pay rises, these groups would come back to the negotiating table. It's just a weird system that we've employed in this country to to give contracts out like this to healthcare workers, etc. But what can we tell from this is the fact that the government also capped certain key workers, sort of public sector workers at, I think it was like a below inflation rate for the last decade as well. So I don't know if this pay increase will, go over that and give them the amount that they deserved over the last 10 years. But I doubt it. But, the argument that we don't have the money and all this stuff is a load of rubbish, considering how much money the government have borrowed and how much the fact that the NHS carried us through this pandemic. Like, even if we have to borrow money to pay them, A, that money is going to go into the economy. B, how expensive is it to keep training new staff if prior staff, trained up staff, keep leaving? Why? Because they don't get the help, the support, or the love that they need to stay in this country, which apparently values them through clapping. I've also seen tweets about how much it costs for student debt for NHS workers. I would get rid of student debt for healthcare workers. You just make it a contract that they have to work in the NHS for a certain amount of years, and you don't have things like student debt, so they can at least keep the money that they make as low paid as they are right now. You're talking about 83 grand, I think that is, for her student debt. I have no idea how it's so high. Also, the fact that you have to pay 5% interest rate, like what? Honestly, it's a shambles in this country. It's an absolute shambles. I don't know what more to say apart from this country's let down key workers, especially those that work in the healthcare industry, and it's just painful. It's just painful, and I know I use that word a lot. But these people are suffering from things like PTSD and other problems, and they are not going to get the help or the funding that they deserve. The way the NHS contract should be given out is the same way MPs' payments are dealt with, where you have a separate body dealing with it. Why? Because it makes it not political. You give it to an independent body who reviews, the payments, how much healthcare workers in other countries gets paid, and you go from there, and you give it a slightly higher rate in order to attract healthcare workers from around the world, and also keep the ones that we do have. Also, you start increasing things like GP surgeries. You start, creating more GP surgeries. You start creating more hospitals. You start, adding, expanding or building new hospitals. The government announced 40, but really it's just 6 hospitals they've added that they're going to create. The rest are just renovations they're going to make. So shocker there, government lies once again. But if the current system keeps going and you have things like issues with beds, always hitting near full capacity during the winter, and staff being four nurses short out of like a 20 nurse team or something like that, these people are inevitably going to leave because other countries can offer them more pay and less work, in a much better funded facilities with much more staff. It's a no-brainer. If someone says to you, look, we're going to pay you more, we're going to make it so you're not going to be a stress because you're going to have enough healthcare workers around you, etc. You're going to get the mental health support that you need, and also you get to live in a much nicer country in terms of climate and things like that. It's going to be very hard for you to say no. You might have language barriers or accent barriers and stuff like that, but most likely going to take it if they're offering 5 or 10 grand a year more, along with other things. It's a no-brainer. So we're going to lose a lot of healthcare workers because Dishi Rishi and Bojo the Wonder Clown have no idea what they're doing, and the Labour Party, haven't been super quiet on this. But I stress to you this clip here from Annalise Dodds, where she's against tax rises. She should be saying, look, we want to increase taxes on these corporations that made a lot of money, and what we're going to do with the money is we're going to give some of that. We're going to give as much of that money as we can to the NHS in order to help our key workers who have carried this country. And what we're also going to do is look at giving some money to the key workers who have carried this country through the pandemic. That's what the Labour Party should be talking about. But I guess this isn't that relevant compared to the fact that we're talking about Dishi Rishi here, and the fact that he doesn't care about healthcare workers, not a big shocker that the Conservative Party have never cared about the NHS. If they privatise it, they'll make a lot of money from it. But that's enough from me. I've rambled on a long time. Let me know what you think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.